My approach to patient care is basically a multidisciplinary approach. Since I do weight loss surgery, we take into account behavioral things that patients do that contributes to their weight gain. Also, we look into the environmental effects, what they're doing, their habits, and take the whole body approach to taking care of these patients. As a bariatric surgeon, we also do a whole bunch of general surgery on our bariatric patients, and we also do them on non-bariatric patients. Those are gallbladder operations, any type of oncological procedures that need removal, stomach cancers, esophageal cancers, pancreatic cancers, ventral hernias, inguinal hernias. Anything that has to do with the abdominal cavity itself is what we cover. During my training, I saw an area that I was really interested in, and helping patients dealing with weight issues and the obesity epidemic really made me focus on that field. I see what patients struggle with when they're going through weight changes and the health effects that's caused by weight gain. And once we reverse that cycle and they lose the weight, their medical problems change. They were able to do things now that they aren't able to do before. Whether it's getting on a ride at Kennywood, whether it's getting down and playing with their children, sleeping better at night, all these things are rewarding.